Today's news is brought to you in part by Dr. George Leeks, Pahrumps optometrist since 1990, offering full-spectrum eye care for children and adults. Call today, 727-8300.
Welcome back to News 46. They go in hoping surgery will fix their problem, but come out with a potential deadly dilemma. Every year, 300,000 Americans get a surgical site infection. A recent report found they're the most common healthcare-associated infections in the U.S. Now, a new prevention program is helping cut those numbers. Andrew McIntosh has the story.
This health tip is brought to you by Humana.
Visit our local office in the Pahrump Valley Junction Shopping Center or call 775-727-0871.
Marilyn Fedor had a bad hip.
Pain is stabbing.
So she got a new one. Doctors started prepping her for surgery 14 days before the operation because
surgical infections are a big problem.
Bacteria that's already on a patient's skin can get into the incision and cause the infections. Dr. Brian Tawney says if hip and knee replacement patients get an SSI, typically their implant has to be taken out and they're put on IV antibiotics.
Typically for 6 to 8 weeks before that joint replacement can then be put back in.
Now Project Joints is reducing that risk. Patients go through an educational class before their hip or knee replacement. Then
they receive a nasal swab. We find out if they carry staph bacteria.
For the final 3 days before surgery, patients use a special antibacterial antiseptic soap.
Well, you scrub your whole body down from the neck down, and then they said to do your leg, my bad leg, for 3 minutes.
And clippers are used at the surgical site instead of razors to help keep bacteria out of the body.
We try to avoid any additional nicks in the skin.
The University of Tennessee Medical Center's infection rate for knee and hip replacements was almost 2% before Project Joints. Now,
it has dropped to approximately 0.5%.
Marilyn says the extra precautions were worth the peace of mind.
I think it's wonderful.
I'm Andrew McIntosh reporting.
We don't know,
And Project Joints is currently in hospitals in 8 states and is expanding to facilities in 5 more states. The doctor says right now the program is only being used for patients getting hip and knee replacements, but the goal is to use it in other joint replacements and orthopedic procedures.